Good morning, everyone. We are going to get started in just a couple of minutes. Some of our presenters are still arriving, and we will get started in just a couple of moments. It looks like Katie has joined us. Amy is having some difficulty getting logged in, and she normally runs these sessions. But Katie, are you ready to get started with your presentation?
Yeah, I think so. I am not familiar with the software, so I'm kind of navigating that a little bit.
Okay, so you see the control panel over on your right-hand side of your screen.
Yes.
So there is a little bar to the left of that that has like your microphone and your video and your screen sharing option. So if you have a PowerPoint presentation, you can pull that up on your computer and then hit that screen, and it will share your screen with all of our participants.
Okay, excellent.
Good morning. I apologize. My computer decided to be difficult today. So I apologize for that. So give me a second here and I will get everything the way it needs to be. And we'll get things started. Okay.
Amy, I already advised Katie how to share her screen.
Okay, good. Excellent. All right, there we go. All right, well, welcome everyone. We're so glad to have you all here this morning. And we have Katie, is it Muir?
Yeah.
Aha, woo. My computer's doing weird things. And she is with Partners in Autism. And she's going to be talking to us today about ABA therapy, giving us a better understanding of what it is, how it functions, and just more information. I also have a pamphlet that was sent to me that they put together about ABA therapy. And after the meeting, I will be getting that sent out to everyone who attended so that you have that as well, and a little more information. And then Katie, if you're ready, I will go ahead and make you the presenter.
All right, sounds good.
And we'll have questions at the end. So we'll let them pile up and then we'll go through them.
Okay, so let me. I am so sorry. It's not wanting to let me share my screen.
Okay, that's weird. Let me see. You know what? I think it might be. Let me try something and see if that worked. Why isn't it letting me? I apologize, everyone. We normally do not have this many technical difficulties. And for some reason, it's not letting me make Katie. It's not letting me change over to her. Can you do it, Joy, on your end?
I see that you have her as an organizer. Oh, we see her screen now.
All right, there we go. Phew.
Oh, okay.
It's a Friday.
All right. So I'm still having a little bit of technical difficulty. I can't see what I'm showing you, so hopefully it's just my presentation. All right. So this, oh dear. This is a presentation that the team of BCBAs we have has put together for you. That's myself, Kristen Barnes, Kelly Phillips, and then Lindsay Tuck. And we're just going to go over what ABA is. Okay, so ABA is applied behavior analysis, and it's the study of learning and behavior. And what we do is we study how the environment affects behavior, and we use what we learn from that to alter the environment and in turn alter the behavior. The most commonly used method for ABA is called positive reinforcement. And that is where we, so positive reinforcement means that something was added to the environment and that increased the rate that the behavior would occur in the future. So sometimes that can be something as simple as an edible, and sometimes it's more complicated. More often than not, we don't use edibles very often, but more often than not, it's going to be something more complicated like attention or tangible access to a toy or an activity. ABA focuses on the areas of social communication, language skills, play and leisure skills. I'm going to break all of these down a little further in just a moment. Pre-academic skills, so not academic skills themselves, but the building skills to get there. Tolerating skills, such as tolerance for sensory defensiveness or tolerance for activities. Adaptive living skills, so making sure if it's an age-appropriate skill that they can reasonably care for themselves. And then maladaptive behaviors, so any behavior that might interfere with learning. Okay, and this is going to break down social and communication and language skills a little bit more. So play skills with peers, that's very important. Play skills are how typically developing children learn to engage with other people. Appropriate behaviors for social settings, also important. Applied behavior analysis focuses very much on what is socially appropriate. So that could be different depending on where you live, and that's very important. Recognition of emotions in self and others. A lot of our kiddos really struggle with this, and that really determines how well they can communicate with other people based on nonverbal interactions. Conversational skills, functional communication training. So many of our kids can communicate, but it doesn't mean that they're doing so functionally. So we kind of run into a situation where mom and dad might know what you want, or your immediate caretaker might know what you want. But if you were to ask a teacher or someone who doesn't spend as much time with you, they're not going to know what that means. Requesting and labeling things. You'll hear the words manned and tact. Mands are requests and tacts are labels. So we work on that quite a bit. Just anything that is really important for being able to communicate with other people. Listener responding skills. If you're asked to find a shirt out of your drawer, can you do that? And then labeling features, functions, and classes. So do you know what a fork is for? Can you identify that a fork has prongs and a spoon does not? Can you identify that they are both eating utensils? Okay, play and leisure skills are very important. As I said, that's how typically developing children really learn a lot of what they know about social interactions, by playing with other children and imitating other children. So we focus on peer play, which is play directly with other children of the same age and the same general interests. Group play, so sitting in a group of 3 or more children. Some children do very well with one-on-one peer play and do not do well with group play. And for some children, it's the opposite. They do great in larger groups, but if you have one-on-one, they're not accepting of that environment. We also work on pretend play. Pretend play is important because that is how children learn how to interact in different situations without having all of the consequences that might come from that interaction. We work on functional play. So pretend play, that's where you play, like if you were to play restaurant or grocery store, and get to really practice those skills in a pretend setting. Independent play. So some children cannot play by themselves without becoming upset or needing constant attention from an adult or another child even. So we do work on that. And then increasing their range of interest. So often what we run into is that our kiddos have a very limited range of interests, or the interests might be not age appropriate. So we really work on a concept called pairing, where we take what they really like and we put that together with something that it would be helpful for them to like developmentally. And we just so we combine those two things. And so if they really enjoy TV, we might let them watch a little bit of TV, but also bring in a puzzle. And eventually they do start enjoying the puzzles as well. Pre-academic skills. So like I said, these are not the actual fundamentals of academics. This is more like, can you hold the pencil? Can you attend to a teacher or to a book for a certain amount of time? Following instructions, identifying numbers and letters and shapes and colors. Can you operate scissors? Can you use glue? Just the really, really basic skills that you would need before going to like a preschool or a kindergarten environment. And then we come to tolerating skills. So much of what we work with this is revolved around sensory issues. So there might be aversive stimuli. That could be sounds, that could be lights, it could be textures. And it's not the same for every child. So some children don't like loud sounds and some children don't like quiet sounds. So we don't work on necessarily making that the norm for everything. Just if these things happen, can you tolerate them? We also work on tolerance for task completion. So really just completing a task that someone else has given you to do. Sharing is a big one. And removal of preferred items. Denied access to preferred items. So just if you ask for something and someone says no, are you going to be okay with that? We work on that both with preferred items and non-preferred items, or not items that you are never allowed access to. So dangerous items. Tolerating transitioning between tasks and activities. A lot of times just transitioning from one task to another can be very stressful. transitioning to new areas or locations. Often what we'll see is that if you walk a certain direction down the hallway and you always go that direction, or if mom drives a certain way to the store and always goes that way, if another direction has to be taken for some reason, that can cause just a lot of stress for the child or a meltdown. So we really work on tolerating that in small increments. Also losing games, and then schedule or routine changes, and then being corrected. Some children really do not tolerate being corrected well. So what we work on with these is we will introduce them in small increments and then slowly build so that it decreases the amount of stress and the amount of frustration. And we also work on adaptive skills only if they're appropriate, both age appropriate and developmentally appropriate. So toothbrushing, hand washing, hygiene, basic cleaning, making their own bed, household chores that a child of that age might complete, cleaning up after meals without leaving a giant mess. And the reason that we focus on these is, especially for children who will not eventually be able to live on their own, this could be the difference between being able to have success in a group home setting and not. And then we work a lot on maladaptive behaviors. And by maladaptive behaviors, you're going to see crying, yelling, whining on this list. What we're talking about with those is when they are not in response to a like being hurt or falling down, or we're not talking about that situation. This is more of when they get told no and they're crying or yelling or whining, or when the lights are too bright that day and they're crying. And we also work on running away, or we would call that elopement. So that's just something that children need to be able to do, is just to stay with the adult that they're meant to stay with, so that when we do send them into a school environment, they're not running away from their one-on-one if they have that, or their teacher, or whatever they have. And then also, we work on aggression towards others. So kicking, hitting, punching, biting, whatever that may look like. Most schools have a no tolerance policy about aggression, so we really work on that, and obviously it's just not appropriate. And then the same for property destruction. We work on throwing items, swiping things off of tables, breaking items. This might also include overturning furniture. And then any self-injurious behavior, we also try to work on that. So that could be headbutting, like the table in front of them, or walls, biting, hitting themselves, anything like that that could harm themselves or others is going to fall into this maladaptive behavior section. Okay, so we often get asked, how does ABA work? ABA therapy is completely individualized for each child. What we do is we would perform a number of assessments depending on the child and their development level. We decide which assessment is going to be most appropriate for them, and sometimes it's a combination. And we would also do a parent interview. We talk to the parents about what their gestation looked like, clear up to any education through public or private education systems that they've had thus far, any other services that they've gone to, really anything that has happened in their life before they have come to us. And then we also talk about what the parents' concerns are, what is happening in the first place that has brought them to us, or that has gotten them referred to us. And then we do an observation. So we bring the child in and we basically just play with them and We take notes on how many requests they make and how many things that they're labeling, and if they're able to interact with other children, or if they're attempting to interact with other children, if they're attempting to interact with us even. And then once they are an established client, each client has their own set of programs based on the assessments, and the BCBA writes all of those programs. And then they're in one-on-one therapy with a behavior technician who collects data on all of those programs throughout the day. And then we put those data into charts that are, you can see here. This is kind of what one of our charts would look like. And we make sure we make notes of anything that might affect our data. So if we change anything to do with the program, or if the child is sick for a week, or if they go on vacation, if they get a new technician for whatever reason, all of that goes into the chart so that we can see exactly what is affecting the data. And then we use those charts to analyze the data and see which way our trajectories are going, so that we can tell if our skill acquisition is increasing, or if it's at reached mastery, that we can move on to the next step of that program. And if it's not increasing, we can make a change to try and establish a better rate of skill acquisition. So it might be that we back up to the very last step that we did before, and it might be that we back up maybe just a half step to try and get us up to the next place that we need to be. And as each skill is mastered, we do move on to the next skill that we would have a written plan for that client. And most of these skills do build on each other, so we don't have to worry about maintaining them too much, because we try to set them up so that they will maintain themselves. Okay. Who provides ABA therapy? A board certified behavior analyst, or a BCBA, must possess a master's degree, pass a national certification exam. Some states have a state license as well. Indiana is not one of those states at this time. So the BCBAs are the people who will conduct the assessments, analyze the data, develop and modify any programs. They also write the behavior support plans and change them as needed. They provide the parent training and oversee the implementation of day-to-day programming. So we also, throughout the day, we are around and observing the children with their RBTs, so that we can make sure that everything is going as we planned. And also that provides the RBTs a lot of opportunities if they have questions about what they're supposed to be doing, or if it's not working out right and they're just not sure what to do next. We're always around to help them with that. And then an RBT is a registered behavior technician. They must possess at least a high school diploma and pass the national certification exam. They provide the one-on-one direct therapy all day long. And how many therapists your child will have per day really depends on what clinic you're at. Everyone does it kind of differently. Here, the kids only have 2 therapists, and they would have each one for half of the day, every day. And they also implement all of the programs that are developed by their BCBA. Who pays for ABA? Typically, insurance is who's paying for ABA. All of the clinics in the area do take different insurances, so it's really determined by what providers are covering each clinic. But typically, Medicaid, the waiver services cover a lot of ABA. Occasionally, we will have individuals who self-pay or self-pay for a short period of time while they're waiting on their waiver to go through. But ABA therapy is very expensive, so self-pay is not typically feasible for most people, and if it is, it's for a very short period of time. Okay, hours are determined based on the assessments that the BCBA completes with each individual. The BCBA, once we do our assessments, we write out a whole treatment plan that is sent to the insurance company. And we will put in there our recommended hours per week of ABA therapy and also the recommended amount of parent training and recommended amount of BCBA supervision time for that individual. We also always discuss the amount of hours that we're going to submit to insurance, or we discuss it with the parents, I'm sorry. Discuss the amount of hours that we're going to submit to the insurance company. Ultimately, the insurance company decides the amount of services that they will cover. Typically, if they disagree with us, we do appeal it and refute it until we can at least find some middle ground. And then the BCBA and the family coordinate this information along with, in our case, we have a clinical director who finalizes our schedule just to make sure that everything is going to fit properly. How many hours of ABA therapy is typical really depends on the individual. ABA is very intensive. It is all, I guess, however long they are here, it's intense for that amount of time. So it's typically between 10 and 40 hours a week, depending on medical necessity and also depending on how much the insurance is willing to cover. Many of the kids are here at least for 20 to 40. Most often, children will receive ABA therapy 5 days a week. Most of them are here all day or nearly all day. Obviously, this is still depending on age, medical necessities, barriers to success in school environments. Sometimes children are only with us temporarily. If they are just not quite ready to be successful in a school environment. So they would come here and we'll get them ready for that transition. Often younger children who are not yet in school are typically here longer hours. And then it is also possible that some children may go to ABA for half of the day and also then go to school for the other half of the day. It really just depends on the child and what they need. The ABA is designed to be a temporary service provided for an average of 1 to 5 years. So ABA is not forever. Also, we do want to make note of that ABA is not a substitute for academic learning. We do not directly work on academic skills. So it is important that we're working with the school system, working with the parents to make sure that the child is not falling behind academically. The location of ABA therapy is really determined by the individual's need, the resources that we have, and then the insurance coverage. Some insurances only pay for in-clinic therapy, and some insurances are willing to cover community and home-based therapy. So it really boils down to what the insurance is going to pay for and what the individual needs. For children who are looking to go more into a school environment, the in-clinic environment is more similar to that than being at home. Most often, it takes place in a clinical setting. So clinics, depending on their size, can have varying numbers of children. But each child will have their own space where their should not say where their therapy takes place, but where the abundance of their therapy takes place. Okay, how can you determine if ABA is going to be effective? The assessments run by the BCBA, they will always share the results before sending it in to anyone, and their determination of medical necessity. So depending on what they find, that's really going to determine if ABA is going to be the right choice. Also, the individual and family can determine if it's going to be feasible for them. Not everyone can, take their child to a clinic every morning or every afternoon for a few hours and then go pick them up. It's just not feasible for everyone. And then ABA has been researched and demonstrated to be most effective as early as 18 months. Usually the earlier a child can get into ABA, the more success they're going to have, the more effects you're going to see from it. As children get older, usually beyond the age of 8 or 9, we'll start to see them kind of plateau. And it's not to say that they're not still gaining anything, but they are gaining less for sure. Some considerations to take is the individual or family able to consistently commit to the hours in the schedule? So we've had in the past families that had transportation barriers. They just couldn't, they were working parents and just could not feasibly get their child here within our hours of operation. And then children cannot ride a bus alone, obviously. So it was just a really big issue. Barriers to the time commitment. So ABA is, again, an intensive therapy, and we do encourage families to have their child be here all of their medically necessary hours that have been approved. So often that's 40 hours a week, and some families just cannot commit to that, or some families like to take lots of vacations, and that's also can be really disruptive to their child's ABA therapy. And then another thing to consider is parent and guardian involvement. So ABA is not just sending your child to an ABA therapist and then picking them up and going about your life just the way you always have. We also provide parent training. We provide skill builders for parents to work on at home. We do in-session training tasks where they have to watch videos, and kind of we work together to help them know how to generalize their children's skills to the home environment, and also help them know how to handle behavior situations at home. And the reason for this is if the parents are not willing to commit and participate in their child's therapy and work on things in the home as well. We can work on things forever, but it's not going to generalize into other settings unless the parent is really willing to get in there and get their hands dirty. A lot of people want to know how to determine if they are with a good ABA provider. So we've kind of laid out a few things to look at. Do they communicate with you using language that you understand? So are they using a lot of jargon and words that are outside of normal language? And if they are using jargon, are they stopping to explain what those words mean? Are they responsive to your questions and concerns? That's really important. A good ABA provider should be answering your questions as best as they can, or at least looking into things for you if they don't have an answer for you right away. Do they convey respect for the client? So not only the client as in the parents, but the client as in the child. Something that we work on very much here is respect for your clients and always protecting the client's dignity. So we do not talk about their behavior in front of them ever. And we don't talk about them like they're not in the room. Are they prioritizing parent training and parent involvement overall? So a good ABA provider is going to try their best to get you as much parent training as they can, and really try to get you involved in your child's therapy and your child's programs. Are they providing evidence of data to support changes in goals and procedures? A good ABA provider is going to show you your child's graphs. They're going to show you exactly what they're looking at and explain them, so you know exactly why a goal is being considered mastered or why a goal is being changed. They're going to communicate their plan for transition into a less restrictive environment. Like we said, ABA is not forever, so it's always good to go in with a plan for what criteria you're going to need to be removed from the ABA therapy clinic, I guess. So do they have a plan for that transition already in place, or are they just making things up as they go? Definitely something that you want to look at as you're looking at an ABA provider. And does the client respond positively to the presence of your therapist or to going into your clinic? The child should be ecstatic to get there. They should be asking, most of the kids call it school, just because that's what's easiest for the parents. And I mean, obviously, people don't want their small children to be looking back at their childhood and see that everything was different therapies. So a lot of our kiddos do refer to ABA as school, and they're excited to get here. They're excited to go to school in the morning. They get up and they are asking for their therapist to go to school and see their therapist. On Saturdays, they get up and they're asking to go to school. They love being here. We've even had situations where we've had to work on tolerance for going home at the end of the day. So if your child is not having fun and is not excited to be there, something is wrong, and that's something that you really need to look into. How do you start the process to get ABA services? The first thing you're going to need is a diagnosis from a neuropsychologist. There are a few in the area. To get into them in the first place, you're going to need a referral from the child's pediatrician. So once you have that, you want to tour all of your local ABA clinics. Go see as many of them as you can. Get on their wait list because they're usually very long. Usually it's a minimum of 6 months. And then if you choose a clinic, you can always call the other ones and tell them that you want to be removed from their list and you're no longer interested. That is completely fine. When a space is available at the clinic you've chosen, they're going to arrange that assessment with you, and they're going to provide you with more information of what their specific clinic policies are to do that. Each clinic is going to be a little different, but they will definitely walk you through what you need to do next from that point. And then we put together a list of questions that you're going to want to ask your potential providers. You're going to want to know what insurances they're in network with. If they have a wait list, the answer is probably always going to be yes to that. You want to know how long it is. What type of training do their staff receive and how often they train them? How do they manage their safety concerns? You're going to want to know what kind of risk management programs they're using. What is the criteria for physical behavior management? How many technicians will be working with the child in one day or in the week? You want to ask if you can go observe your child. Do you need to schedule that in advance, or can you just pop in? Obviously, right now, things might be a little different on that one. And you're going to want to know how many BCBAs and behavior technicians they have on staff. How many clients will be in the clinic during the day might be worth knowing. If they offer home-based therapy or clinic-based therapy. If you're looking for specifically home-based therapy or specifically clinic-based therapy, that's something that you want to convey as you're looking into clinics, because they can also, as you're applying to different clinics, can also look into your insurance coverage for you and see what your insurance is going to cover. How often is parent training provided? Typically here it is every 2 weeks or every week, depending on your insurance provider. How often will you meet with your child's BCBA? What you don't want in this situation is a BCBA who is not around very much. You can ask how goals are going to be determined for your child and how often those goals are going to be reevaluated. And then you're going to want to know how progress is evaluated and how often. And when that progress will be shared with you. Another important thing is you're going to want to know when and where the child eats and if the meals are going to be provided for them or if you are responsible for providing the food for your child. You're going to want to know how many opportunities your child's going to have to interact with other children. Obviously, that's another one that right now is very limited in all clinics and very not what the typical situations are for that. You are going to want to know how you're going to be notified if your child is involved in aggression by another client or if your child is aggressive toward another client. You're going to want to ask about visitors. Can anyone you arrange come in and watch your child in therapy? Ask about vacations if they're extensive, if your spot will be held. Ask about bringing in items from home. Ask about picking up your children early and the policies on late arrival or pickup. Ask about what the daily communication with the parent looks like. Here we have a parent note that goes home every single day and just tells them a few fun things of what their kid did that day. And then we also put a couple of the positive behavior goals that we have, so skills that we've targeted for increase on there. And then we also put in at the bottom, if they're running low on snacks or diapers or anything that they might need during the day, so that the parent always has that note every day and they can look at that and see a little snapshot of what their child did that day and if they need anything. And then we are also readily available here by email and telephone. You're going to want to ask about the holiday schedule and the weather schedule. Ask if the child will be playing outside or if all play will be done inside. Ask about bringing in treats if that's something that you like to do. You're going to want to know what the transition criteria is for your child for transitioning out of ABA and into school. This is really important. your BCBA should have a list ready for you about what that's going to look like. Ask what your child does all day. Usually we have a written kind of vague schedule of what they do, but it is not out of line at all to ask what the child does. If the child whoops, oh goodness. If the child stims and are they going to be punished for it? Are the children allowed to stim? Here, we do not punish STEM and we don't interfere with it unless it is interrupting skill acquisition or dangerous in some way. That is not the case in all clinics, so you definitely want to make sure you know what their policy is on stimming. And stimming is self-stimulatory behaviors. So some children script, which is where they're repeating lines of songs and movies throughout the day, and some children like to tap on their tables or rock a little bit. When will you meet your child's BCBA and behavior technicians? And then you also want to know if you can tour the facility. You should be able to do that before choosing a facility. Again, right now, that might be a little more complicated as we're dealing with all the COVID-19 precautions. Okay. That is my last slide, so I am ready to take questions if anyone has any.
Okay, let's see what we have. Let me scroll up. Is ABA therapy available for someone over 13 years old? I'm hearing that services are usually aged out around 13.
It really depends on the necessity of the child. Here we actually have 2 children who are older than that.
Okay. I've been told that in the state of Indiana, only those with the diagnosis of autism can access ABA services. Is this correct?
That is correct, and it does need to be a diagnosis from a neuropsychologist. There are only 3 that I know of in the area that do that. But they're also at Riley, Cincinnati Children's, bigger hospitals definitely have more access to that.
And then you had already answered about ABA therapy ever provided in the home. Do you know which specific waiver service covers ABA?
It is my understanding that they both do, but I am not 100% sure on that. We actually have a waiver services kind of specialist here, and I can have her get in contact with you about that.
Okay. What all diagnoses qualify for ABA therapy? I know obviously autism, but are there others as well?
Not in the state of Indiana. Oftentimes there are other co-occurring diagnoses. And also what we'll run into is that our local neuropsychologists do know that you need to have that diagnosis to get ABA therapy. So if they do think that it is beneficial and the child does meet some of the criteria, they will go ahead and give them that diagnosis along with the other ones.
Okay. Does anyone else have any questions? Anything else you'd like to know about ABA? We'll give everyone a minute or two to see what they come back with. Does the waiver pay for ABA? I thought that it did not. It does, but it's very specific, I know, correct?
I'm currently looking that up right this second.
Okay. My understanding is I think it only pays for up to age 12. And I know there's specific rules about you have to start at a specific age in order for it to be covered as well. Are there any specific programs that you know of for older kids that might be helpful who maybe aren't able to, who've aged out of or who can't get coverage for ABA?
There is, I'm not sure if they're referring to like a social program, but there is a program called Boundaries Crossed, and it is a social program for middle school and high school age children, just to go and work on social skills, and it's actually run by us. So
Okay. And that is Partners in Autism, as a reminder. And so if we wanted, how would we go about getting somebody set up in that program?
So if you visit our website, partnersinautism.com, and then go to, I believe it is social groups.
Okay.
It will be listed under there.
Excellent. If parents aren't cooperating with ABA or following through at home, are there consequences?
It depends to what extent. It's really individual depending on that person. Like if we know that there's something really just like, I don't want to say like traumatic, but if they're having a really hard time for legitimate reasons,
Right.
we might overlook quite a bit. Typically, if we can't get them to participate in parent training for a certain period of time, we might have to discontinue services just because it's not going to be effective or beneficial to their child at that point. Also, many of the insurance companies actually require it. So if we cannot prove that we are meeting with them a certain amount of time, the insurance company will discontinue their coverage.
Oh, okay. Any other questions? This has been really informative and I think very helpful to help us all kind of get a better understanding of how ABA works. Are there any specific behavior modification therapies that are helpful with older kids?
Again, it really depends on the child because a child's physical age does not determine their development at all. So I'm not sure what you're referring to as older kids.
Okay. I think she's thinking more in terms of, again, since like I know the waiver only pays for it to a certain age. So, and if a family doesn't have private insurance that can cover it, what would be a good alternative, I guess, to ABA, or what could they use in place of? Would traditional behavior modification services work, in the same kind of way?
It wouldn't be as effective just because ABA is such an intensive therapy.
Right.
But we do work. Another factor of that, though, is that when we know typically when a child is going to age out of ABA, and it's never an instant cutoff, they don't go from 40 hours to 0 hours in one authorization. It is usually off 10 or 5 hours at a time. So
Okay.
when we start seeing that starting to happen, we do start to prepare them for more independence and prepare the family for being able to complete their behavior programs without us. And that's why the parent training is so important.
Okay.
So I found some answers on the waiver service. Those that have been case managers for quite some time remember that years and years and years ago, when the autism waiver existed, there was a standalone service for ABA that only paid for services up until, like we were mentioning earlier, till age 12. When the autism waiver went away and got combined into the CIH waiver, that standalone service went away. I did a search of the waiver manual just now while we were on the phone here, and in section 10.14, the area that talks about the intensive behavioral intervention, there is a paragraph in there that talks about if a child under the age of 21 is needing applied behavioral analysis, that needs to be provided through the family's insurance plan. That's not something that the waiver covers at this time.
I know what I was thinking of. Regular Medicaid will pay for it. There
Okay.
are rules I know regarding Medicaid, not Medicaid waiver, but straight Medicaid that will provide ABA if a child starts by a certain age, but their coverage of it ends at age 12. So I do know there is some Medicaid. I know I'd read it somewhere. So, any other questions before we let Katie go? It's 5 minutes till 11, so. We'll give it a minute here to see if anything. Okay. I am not seeing too much come through. I think lots of information. So I think that's been really, really helpful.
Thank you so much for having us.
Well, thank you so much for presenting. We really do appreciate it. Like I said, I think, there's so many of us who have heard ABA, but have not really had a chance to get to know a whole lot about it. So I think this was a really beneficial one for all of us. We appreciate your time and all the information. As I said, partners did put together a little pamphlet that kind of condensed a lot of the information that Katie talked about. So I will get that sent out to everyone later this afternoon. Hopefully you're not hearing there's lawn mowing going outside my window. Great timing. I apologize. So be looking for that later this afternoon. For Advocacy Link staff, once you leave here, please log in to the staff portion. Thank you again, Katie, and we'll go ahead and end it, and have a great weekend, everyone. Goodbye.
Thank you.